Everyone right to go?
From the most locked-down city in the world to the highest cases in the country, Victoria is breaking unenviable records.
There are 1,763 new cases of coronavirus in Victoria, all locally acquired.
And sadly, 4 more Victorians have died.
We extend our deepest sympathies and our condolences.
Despite the record numbers, the state is still on track to ease restrictions on October 26. Currently, more than 83% of the eligible over 16 population has had their first dose.
There'll be a time for that lockdown to lift, and that's when we've got 70% of the 16 plus population across our state, not with 1 jab, but with 2. We're not chasing zero.
It comes as New Zealand, the last bastion of COVID-0, has conceded Delta cannot be driven back. 7 weeks into the Auckland outbreak, Prime Minister Ardern changing tack.
It's clear that long periods of heavy restrictions has not got us to 0 cases. Elimination was important because we didn't have vaccines. Now we do. So we can begin to change the way we do things, but we cannot rush.
And in a reminder here, it's not just hospitalisation and deaths to be avoided. 2 COVID survivors describing the impact the virus has had on their lives.
The initial illness was incredibly frightening. The feeling of straining against your own body, trying to expand your lungs against this invisible force, struggling to breathe.
By day 11, I continued to be bedridden, unable to sleep. I went into ICU for 6 days. So lucky not to be on a ventilator like so many patients around me. My lungs had collapsed and I required constant flow of oxygen.
Long COVID takes its toll in many ways, and it's the invisible impacts that mentally weigh you down.
COVID also stripped me of my dignity, unable to go to the bathroom or wash myself. I'm still feeling the long-term effects of COVID.
It doesn't matter how young you are, it doesn't matter how fit you are, and it doesn't matter how indestructible you feel. COVID can still hit you.
The message crystal clear.
We can fight back, and we can now protect ourselves and those we love.
Don't play Russian roulette with your health or of those you love. Please get vaccinated.
How important are those voices, especially as we open up and vaccine rates go up? Because you can still get COVID, and long COVID, as we're learning, it has horrible effects.
Yeah, I agree. And the Russian roulette line I thought was a really good one, because I feel like we've been overcome with a sense of exceptionalism. Like whatever happens, it's numbers. It's not me. Like it's not something that would affect.
And there's fatigue from numbers as well.
Yeah.
Whereas when you hear a human voice, you're like, oh, that doesn't sound nice.
Yeah.
No, and I bet all of them didn't think they were going to get it either,
exactly
you know.
right.
The fact is, we're only a few weeks away from opening up, so it really feels like you need to. If you've been hesitant, you need to think about it really now, because it's like you are rolling the dice.
Yeah, you're putting a spotlight on yourself and saying, come and pick me, which is a dangerous thing to do.
Encouraging stats out of Victoria today. Apparently, the Premier said we're on target to meet or even perhaps beat the target for second dose, which is what opening up is based on. So that's encouraging.
And apparently around 12 days away potentially from 90% first dose, which would suggest if you get to first dose, you get to second eventually. So really good signs. I find the New Zealand situation fascinating, that New Zealand has now finally called it and said COVID-0 is over.
Just recanted.
Yeah, well, because their outbreak's really interesting, because it hasn't been huge. Like they're getting sort of 30 cases, then it goes to the teens, but they just can't get rid of it. It's a bit like the Canberra situation.
So I wonder what it goes to once they now just let it go and go, we're happy to be.
Well, they've got the vaccination thing, and they're probably just a touch behind us, maybe about where we are on the rollout.
Yeah.
So that'll be interesting to watch, but that's exactly the point. But the issues are the same, right? So they're looking towards 70 and 80%, but their Maori vaccination rate's quite low.
Right.
And so they're worried about that in the same way we've had those conversations about Indigenous. Like, it's just like history is written and we just fulfil it. You know what I mean? Like we're all on the same journey and we get to the same place one way or another.
I know, that's what I say to the children all the time. One way or the other, we'll find out. When they're like, what's going to happen?
Yeah.
With so much content online, it's sometimes hard to keep up with it all. And let's face it, who has the time? The Project YouTube has you covered with the stories that matter. Hit subscribe for a daily list of the news that you need to know.